This chart shows how tolerance to alcohol works. High tolerance means that a person can drink more than most people and not feel alcohol's effects, even though they are more intoxicated than they feel. On the left, a typical driver may feel intoxicated when his or her blood alcohol level rises to 0.08 and will demonstrate erratic driving. However, a person on the right with drug tolerance to alcohol may not feel intoxicated, and erratic driving may not be observable until his or her blood alcohol level rises much higher. Likewise, more serious problems with alcohol's effects on the body will affect the alcoholic and the non-alcoholic drinker differently. On the left side of the chart are the corresponding behaviors of a non-alcoholic person as their blood level rises. Notice at some point death will occur, but it is below the point of the person who is alcoholic. By the way, the highest blood alcohol level in an alcoholic who lived, found in the medical literature, is 1.5% blood alcohol level, nearly 20 times legal intoxication. Cross-tolerance. Cross-tolerance describes the ability of an employee with a drug addiction problem to substitute one drug for another. For example, substituting Valium or Xanax for alcohol, a common occurrence for alcoholics who seek treatment for anxiety caused by alcohol use and withdrawal. Now the alcoholic becomes addicted to both. Loss of control is a hallmark of addiction and addictive disease. The emphasis is on the word consistently, because anyone can stop drinking whenever they want to. It's staying stopped that separates the social drinker from the alcoholic or addict. Loss of control means the inability to consistently choose when one is going to drink, where or what occasion will drink, and how much will be consumed, and very importantly, what will happen if one drinks. Social drinkers can consistently predict their ability to control all the factors shown here, such as time, place, and amount of alcohol they consume. As the disease progresses, most alcoholics will eventually discover maintenance drinking. This is consuming alcohol at a rate and frequency to stay continually intoxicated. This is why some alcoholics drink in the morning. An employee who consistently has alcohol on their breath in the morning is maintenance drinking to prevent withdrawal. Alcohol or drug addicts with job problems who are in denial about their addiction are often convinced that other problems cause their job performance shortcomings. Such employees are able to convince the supervisor that these other problems are primary. Here is a good understanding of how denial works. Addicts have a definition of addiction that excludes them. Addicts focus on symptoms of addiction that they do not have and use this information to avoid self-diagnosis. Addicts change their definition over time to exclude worsening symptoms. Denial is a defense mechanism that works hand in hand with myths and misconceptions about addiction. Denial is used to avoid awareness and is reinforced by others who are willing to participate in it. Depressants. Depressants are also called downers, sedatives, hypnotic drugs, minor tranquilizers, and anti-anxiety medications. They are grouped into two classes: barbiturates and benzodiazepines. Barbiturates are the more dangerous of the two, especially when mixed with alcohol. Both classes of drugs have alcohol-like effects depending on the dose. Absenteeism, reduced productivity, and increased accidents are associated with abuse of these drugs. Their impact on psychomotor skills is severe and makes them especially hazardous. Depressants produce feelings of euphoria, relaxed inhibitions, disorientation, and reduced motor coordination. Major tranquilizers or barbiturates. Tranquilizers are used orally, but some can be injected after the capsule's contents are dissolved in water. Withdrawal symptoms include anxiety, insomnia, tremors, delirium, convulsions, and possible death. Overdose involves shallow respiration, clammy skin, dilated pupils, weak and rapid pulse, coma, and death. Symptoms include slurred speech, disorientation, drunken behavior when used in large quantity. These drugs are legally prescribed medications, but are often illegally diverted in hospitals. Barbiturates are dangerous because tolerance increases rapidly. Increasing dosage levels to get the same effect eventually approaches lethal limits. A drink or two is all it may take to go over it and cause death. Shorter-acting barbiturates are preferred by addicts, such as Seconal, Nimbutal, and Amytal. These drugs can also be crushed up, dissolved, and injected.